Yeah.
All right, Dr. Patel, let me ask you something. You know, some people say that one of the reasons that denture isn't quite all that good is because your arches start shrinking with a denture, which they wouldn't do with an implant, and they shrink, and thus, like, those are the people who look like very ugly with a caved-in face. They look like a dried-out pumpkin or like a dried-out tomato. Is there something to that, or is that just a myth?
Well, no, it does shrink. Does do shrink after the tooth are extracted in a denture faster than what it is around the implants. In the denture, once the tooth is extracted, we lose about 30% of the bone by itself. And then after within about 9 months, we may lose another 20 to 30% of the bone. And once the dentures are made, and because of the load of the dentures and because of the ill-fitting of the dentures, or because if the dentures are not relined properly in time, which is every 3 years, then there will be more shrinkage of the bone as the patient starts using it, and the arch will cave in. All the gum tissue will cave in also at the same time. The cheeks will cave in at the same time, because now with the bone shrinking in, the denture, instead of closing at a certain vertical dimension, it will take a longer distance to travel to close it, and the patient would look a bit older than when the denture was made, because the whole jaw comes closer and the teeth appear together, more together. So that's why a reline is very much suggested. In an implant, there is not too much of a bone loss. The bone loss would only be there if there is too much heat generated while putting the implant by the dentist, or if the patient is not able to clean the teeth nicely or maintain the implant in a very cleansable way, then only there may be a bone loss. But usually in a denture there is more bone loss than in the implants.
Wow, so basically getting an implant versus denture is like a cosmetic procedure, and one keeps staying younger. And I think that's probably something everybody would like. I mean, who wants to look ugly and old, right?
Yes, if somebody is trying to save money in the immediate time frame and uses the denture instead of an implant, in the long run, the patient will suffer. And with the implant in the long run, there is all the advantage to the patient. By no bone loss, better aesthetic, long-term chewing, and stronger chewing forces with the implants than the forces with the denture. Say the denture may apply 1,000 pounds per square inch of pressure, and the implant may apply close to about 1,200 pounds per square inch. I'm not 100% sure about that figure, but it is more than 10 times, much more than the denture itself. So the pressure itself is very, very stronger with the implants.
Wonderful. Well, it's the looking good which impresses me, and which I think many people will like. Now, if a person, let's just say, has not so much money now, needs to do a denture, but then saves up for implants 1 or 2 years later, is that still an acceptable option?
Oh, we have that option of an extended payment plan, and also we have an option of putting an implant same time and giving him a credit, so that he need not wait for 2 or 3 years and suffer without the teeth, but instead he may place the implant the day he has extracted the tooth, and then make a small payment as he goes along. So we have many payment options in the office which may help our patient, which patients do appreciate this. We have our in-house dental plan also, for which they pay a much more less price for the implant than the actual cost of the implant once they join the dental plan. So there are many ways of cutting down the costs.
Well, that's great news. So basically, I mean, my idea was like, I don't have the money now. I take the second best now because I need some teeth, and then I save up. But actually, in your office, you're willing to put it in right there and have the patients paying over the next couple of years or something like that.
Yes, definitely. We have other options along with that too.
That's wonderful. Well, wonderful, Dr. Patel. As I said, I like the stuff of looking less old. I like that. Thank you.
Right. Yeah, if we can stop the aging process as much as possible, we'll try and do that.
Great.